Hello everyone, I am Gautami from Geetanjali College of Pharmacy. Today we are going to learn about hemophilia, a royal disease. Objectives include introduction, definition, classification, etiology, pathophysiology, clinical manifestations, diagnosis, treatment and complications. Introduction. Hemophilia is a genetic disorder characterized by a deficiency in clotting factors crucial for blood coagulation. This results in prolonged bleeding and difficulty forming clots after injury. People with hemophilia have low levels of either factor 8 or 9. It is primarily found in males but transmitted by female carriers. Hereditary hemophilia accounts about 80% of cases as sex-linked chromosomes. About 20% of cases account as acquired hemophilia due to autoimmune disorder. Hemophilia has been called as royal disease. This is because the hemophilia gene was passed from Queen Victoria, who became Queen of England in 1837, to the ruling families of Russia, Spain and Germany. Queen Victoria's gene for hemophilia was caused by spontaneous mutation. Spontaneous mutation is nothing but changes in the DNA that occurs naturally without any external factors like radiation. Queen Victoria of England is believed to have been the carrier of hemophilia B. Definition. Hemophilia is a congenital bleeding disorder caused by lack of at least any one coagulation factor. Types of hemophilia. Hemophilia A. It is also known as classic hemophilia. This is caused by lack or decrease in clotting factor 8, the anti-hemophilic factor. It accounts for 80 to 85% of all cases and 1 in 5,000 to 10,000 male births are affected. Hemophilia B. Christmas disease. This type is caused by a lack or decrease in clotting factor 9, the plasma thromboplastin component. It accounts for 15 to 20% of all cases and 1 in 20,000 to 34,000 male births are affected, and hemophilia B is less commonly seen. Hemophilia C. This type is caused by lack of factor 11 plasma thromboplastin antecedent. Heckmann's disease. This is caused due to deficiency of factor 12. Hemophilia A. Hemophilia A is also called as classic hemophilia, a factor 8 deficiency. People with this type of hemophilia have low levels of blood clotting factors. It is most common type. Mild hemophilia A. It doesn't have any spontaneous bleeding but unusual bleeding occurs with trauma or major. Moderate hemophilia A. Spontaneous bleeding and delayed oozing after minor injuries occur. Severe hemophilia A. Spontaneous joint or deep muscle bleeding occurs. Etiology. Hemophilia A is caused by a mutation in the F8 gene which codes for factor 8. The mutation can be inherited from parents in an X-linked recessive pattern, that is, mutated gene is located on the X chromosome. A family history of hemophilia A increases the risk of inheriting the mutated gene. Males are more likely to be affected as they have only one X chromosome. Causes of acquired hemophilia. Rheumatoid arthritis. Rheumatoid arthritis is nothing but it is a chronic autoimmune disease that causes inflammation, pain and stiffness in the joints. It occurs when the immune system mistakenly attacks the lining of joints, leading to inflammation and damage. Lupus. Lupus is a chronic autoimmune disease that affect various parts of the body like skin, joints, kidneys, brain and nervous system and other organs, and damages various organs. Lymphoma. Lymphoma is a type of cancer that affect the immune system, especially the lymphatic system. It occurs when the lymphocytes, a type of white blood cells, grow and multiply uncontrollably. Lymphatic leukemia. It is also known as lymphocytic leukemia. It is a type of cancer that affect the blood and bone marrow. It occurs when lymphocytes become cancerous and accumulate in the blood and bone marrow. Pathophysiology. When injury occurs at a damaged area, injury to the blood vessels result in bleeding and vessel constricts and clotting factors are activated. In case of normal patient, fibrin along with factor 8 causes a strong platelet plug to form, and a Stable fibrin clots form over the platelet plug as a final seal on the injury and the bleeding stops. In the case of hemophilia A patient, lack of clotting factor 8 causes a weak platelet plug to form. Incomplete and or a delayed fibrin clot allows bleeding to continue. Signs and symptoms: prolonged bleeding anywhere from or in the body after injury, surgery, or trauma, subcutaneous and intramuscular hemorrhage, hematorosis, bleeding into the joint cavities, especially the knees, ankles, and elbow. Bleeding into the muscles can cause pain and weakness. Hematuria, blood in the urine, gastrointestinal bleeding, intracranial hemorrhage, hematomas, pain, swelling, and limited motion of joints. Diagnosis: clinical evaluation, symptoms and family history, laboratory tests like coagulation studies, activated partial thromboplastin time, and factor 8 assay. Genetic testing include DNA analysis. Other tests like bleeding time and genetic analysis. Bleeding time should be in between 2 to 7 minutes. Treatment: replacement therapy. Factor 8 made from cryoprecipitate, hemophilia A. Fresh whole blood transfusion can be given if the commercially prepared factors are not available. Mild to moderate hemophilia. Desmopressin, release of factor 8 from the endothelial stores. Administration, injection or nasal spray. Antifibrinolytics, aminocaproic acid are given for mucosal bleeding. Supportive management like avoid aspirin and beta-zolidone as they inhibit platelet function. Regular prophylactic treatment can help to prevent bleeding episodes. Orthostatic can be used to prevent injuries. Gene therapy is being explored as a potential treatment option. Products with extended half-life may reduce infusion frequencies. Genetic counseling and antenatal diagnosis should be arranged. Latest hemophilia treatment. Gene therapy, a promising approach that aims to introduce functional copies of factor A gene into the patient's cells, potentially reducing or eliminating the need for regular infusion. Hemilibra. This is a newer drug that doesn't include clotting factors. This drug can help to prevent bleeding episodes in people with hemophilia A. Fistulesiran. This is the first for hemophilia which is effective in both factor 8 and factor 9 deficiency even with inhibitors. Complications: joint damage can occur from repeated bleeding episodes leading to chronic pain and disability. Intestinal obstruction can be seen. Compartment syndrome. It is a painful condition where the pressure within the muscle increases. Chronic hepatitis, risk of HIV and AIDS, exposure to plasma viruses. And to prevent these complications, we should do that prevention of injury should be seen and immunization against hepatitis B. Precaution should be taken before any surgery. Summary: hemophilia is a rare genetic disorder where the blood doesn't clot properly. This happens because the blood lacks certain clotting factors, usually factor 8 and 9. People with hemophilia bleed longer than normal after injuries and may have internal bleeding, especially in the joints and muscles. Reference: for more information, you can refer National Institute of Health, Midline Plus, Mayo Clinic, and Centers for Diagnosis, Control and Prevention. Thank you.